My name is Roisin. I have been working in the cord blood industry now for 11 years, so I've seen a lot of changes in terms of what can happen. What I want to do today is really talk about cord blood, cord tissue, what it can be used for currently, where the research is taking us, and hopefully you'll go home today with a better understanding of what it's all about, and that will help you make a decision which would best suit you and your families. So if we start at the basics, cord blood, it's the blood that's left in the umbilical cord and placenta after the baby is born and the cord has been clamped and cut. About 20 years ago, we found out that it was an incredibly rich source of blood stem cells, so the same stem cells that are present in bone marrow. And we all know what we can use bone marrow for, and I'll come back to that a little bit later. Good morning, welcome. The first cord blood transplant took place about 20 years ago. The little boy had Fanconi's anemia. He used the cord blood from his sister, and the transplant was a huge success, and it opened up the door to many, many more transplants around the world. In fact, there's been more than 25,000 cord blood transplants to date. Most of those are what we call unrelated donors, so you don't know your donor. There's increasing numbers of related donors from siblings, and there's a small number of autologous, which means from the child from which it was collected use. Here in Australia, cord blood transplants are possibly best known for the role in things like leukemia, blood disorders, some solid tumors like neuroblastomas and retinoblastomas. But what's really interesting is overseas, there is an emerging application called regenerative medicine, which is where scientists are looking at how cord blood stem cells can be used to repair or regenerate damaged or diseased tissues and cells, such as are found in conditions like cerebral palsy, diabetes, brain injury, and many, many more. If we look at something like cerebral palsy affects 1 in 500 children here in Australia. Every 15 hours, a child with cerebral palsy is born. There is no cure. The treatments look at treating the symptoms, so things like occupational therapy and speech and physical therapy. We have some very, very interesting results coming out of animal studies which show that cord blood may have a role in treating the symptoms of cerebral palsy. In the US, more than 250 children with cerebral palsy have received their own cord blood, and the results, although anecdotal at the moment, support great outcomes. The parents, the therapists, the researchers are all reporting marked improvements in motor skills and speech skills in these children. I said anecdotal because these experiments or these trials were not formally conducted, and so now what's happening in the US and around the world are formal clinical trials looking at the role of cord blood in treating children with cerebral palsy. Here in Australia, the first clinical trial, together with Monash University, we're about to launch, and that should be ready to go in a couple of months. And so, if you know anybody who has stored their cord blood and their child has had some sort of brain injury or cerebral palsy, we would encourage you to contact us. We talk about cord blood being rich in blood stem cells, and transplant medicine is what it's most commonly used for. What's less known about cord blood is that it's rich in what we call regulatory T cells or immune cells. And these quite simply have a role in our immune system, regulating the immune system. And now researchers believe that these cells may have a role in treating immune disorders. And we say immune disorders like diabetes or perhaps multiple sclerosis. If we look at diabetes affects over 140,000 Australians. Every day, 5 new people are diagnosed with type 1 diabetes, and it is a lifelong illness that people have to manage. There is an animal model of diabetes, and what's wildly exciting is that if you treat this animal, it's a mouse model, with cord blood, that mouse does not develop diabetes. So that's very, very exciting. And early clinical trial results in the US have shown that children who have type 1 diabetes, who are subsequently treated with their own cord blood, have shown a decreased need for insulin. Now, what we're doing here in Australia is we're looking to take a clinical trial one step back and replicate what's happening in the animal model. We're looking at children who are born to a family where there is a first-degree relative with diabetes. Those children have a 6% chance of developing diabetes. We're going to monitor them, monitor their blood, and we're looking for markers that are indicative that diabetes is going to develop. Once those markers are present, there's a 50% chance that that child will develop diabetes within 2 years. We are then going to look at infusing those children with their own cord blood. So replicate what happens in the animal model. Give the children cord blood before the onset of diabetes, and we hope to stop that. That's going to be an international multi-center trial run in collaboration with Westmead Children's Hospital here in Sydney. So quick recap, we have cord blood rich in stem cells and rich in immune cells, called regulatory T cells. The most frequently asked question that I get, and I've been doing this for 11 years now, is, okay, I get it. I understand what it's all about. I understand why it's so rich, but really, what is the probability of my child needing to use his or her own stem cells in their lifetime? Well, there's some great research now that has been published, and that says that the probability of a child needing to use his or her own stem cells up until the age that they turn 21 is about 1 in 2,700. The probability of a child needing to use stem cells, either their own or somebody else's, in their lifetime is estimated to be 1 in 217. And that does not include emerging technologies in regenerative medicine. Those figures tally extremely well with the results that releases from the two biggest banks in America, Cord Blood Registry. Their release rate sits at about 1 in 2,700, as does ViaCord. CellCare, our release rate is about 1 in 3,000. Now, that talks about cord blood. There's also now a new group of cells that we can isolate from cord tissue. Now, cord tissue is quite literally your baby's umbilical cord and the gelatinous substance that is around that cord called Wharton's jelly. We now know that that's incredibly rich in what's called mesenchymal stem cells. These mesenchymal stem cells are very, very potent, very powerful. They can differentiate, which just means change into nerve cells, muscle cells, cartilage, bone, fat cells. There's more than 200 clinical trials taking place worldwide looking at the role of mesenchymal stem cells in a variety of things like bone repair, heart disease, arthritis. If we look at the University of Texas, they're doing a clinical trial on cleft palate. So we all know what cleft palate is, that the bones of the palate don't come together during the pregnancy. A lot of them can be repaired, but there's still problems in getting those bones to meet. If you use the mesenchymal stem cells that are present in Wharton's jelly, they form a matrix and they basically recreate or regrow the bone and draws that bone together. There's trials looking at bone repair for fractures. There's trials looking at arthritis. These cells are incredibly powerful. Another property of mesenchymal stem cells or the cells that are found in cord tissue is that you can co-transplant them with cord blood and you get 6 times better engraftment than you would if you just transplant cord blood alone in animal studies. Now, why is that exciting? Well, because that means that there's promise for using these cord blood stem cells for larger individuals where perhaps you're restricted in cell numbers. So what are your options here in Australia? Well, you've got 3 different options. You can choose to donate your cord blood to the public bank, which is collecting in a number of hospitals around the country. You can collect and store your baby's cord blood and cord tissue privately, or you can do nothing and you can discard it. Whatever your options, we would really strongly encourage you to research what your options are, but not to discard it, because it is such an incredibly valuable resource. The public bank collects cord blood and makes it available to anybody in the world needing a transplant. If you donate your baby's cord blood and then subsequently find out that you need it, there is a possibility that it won't be available anymore because somebody else has used it. If you need to use it for another family member and it's not available anymore, then obviously you can't access it. When you store privately, you can collect from any hospital in Australia at any time of the day or night, and then you can store it for the exclusive use of your child and your family should they ever need it in the future. In terms of what actually happens, it doesn't impact on the method of delivery. Collection takes place after the baby is born. You can have a normal vaginal delivery, a cesarean. Baby has been removed from the field of delivery and is usually placed on your tummy, and the cord has already been clamped and cut. The collection takes 2 or 3 minutes. It's non-invasive, it's not painful. We collect about 70 or 80 mils of blood, and then that's just brought back to the lab for processing. So, just to summarize, I suppose, very important, very valuable resource of cells that have a defined use at the moment for treating blood-related disorders, but have an emerging use for treating a variety of diseases and illnesses like heart disease, spinal injury, brain injury, cerebral palsy, and hopefully diabetes. So hopefully that's given you a little snapshot about what it's all about. If you've got any questions, I'd love to answer them. And thank you for your time. So, any questions?
Yes. Does the cord blood get tested for, I don't know, autoimmune conditions or HIV?
Yep.
Or any?
So the question was, does cord blood get tested for autoimmune conditions or infectious diseases such as HIV? During the course of your pregnancy, as the mother, you are routinely tested for the whole spectrum of infectious diseases, which includes HIV, syphilis, CMV, hepatitis B and C. We again test the maternal blood at the time of delivery because there are some exclusion criteria for the public and private banking. We cannot store the blood if mum's blood is positive for HIV, unfortunately, or if it's positive for syphilis. Now, not very prevalent, but we do have to do those tests. We don't do any other tests in terms of autoimmune disorders at that time. If there's a family history, then perhaps your doctor would be able to look at that. Okay. Question was, how much does it cost? There's a range of costs, depends on the company that you're going to go to. Our costs sit at about $1,500 to start the ball rolling. You can start with a deposit of $150 and you pay the balance of that $1,500 over 12 months. And then there's an annual storage cost. You can prepay everything up front for 25 years. It really just depends. What we've tried to do is make it as flexible as possible. We understand, I'm a mum, we understand that you're usually going from 2 to 1 salaries or 2 incomes to 1 income. And if our payment plans don't suit, we encourage you to come and say, let's work something out. Because you only have one opportunity to collect this blood and tissue, and that's at the time of birth. In terms of the length of storage, from a scientific perspective, once you have the cells frozen in the vapor phase of liquid nitrogen, there's no reason why you cannot store these cells indefinitely. Below a certain temperature, all activity in the cell, in a cell ceases or goes into a state of suspended animation. Research shows that samples have been stored and pulled out and checked 23 years thus far, but from a scientific point of view, no reason why we can't store them indefinitely. Any other questions? About the donate. So the question was, where do I find out more information about donating my baby's cord blood? What you need to do is you need to speak to your midwives at the hospital. It depends on which hospital that you're birthing in. There are 3 in Sydney, 3 or 4 in Sydney, 2 or 3 in Melbourne, a couple in Brisbane, and there's soon to be 1 in Perth. So it really very much depends on which hospital you're birthing in. Speak to the midwives. If they're a participating hospital, they will have the information. The question was, if you were having multiple births, would you store for each child? From a blood-related disorders point of view, perhaps one would argue that you could use 1 cord blood sample for a number of siblings, depending on the degree of match. For the regenerative medicine applications, so that is, it's personalized to the individual, you really need your own cells. So you would have to have your own cells stored. Yeah. Okay.
When you're collecting, how much are you collecting and how much do you need?
Okay. The question was, how much do we collect? The average collection volume sits at about 77 mils, but you can collect as little as 40 mils and as much as 140 mils. The volume doesn't always relate to the number of cells that are present. You can have small volumes that are highly concentrated. You can have large volumes that are perhaps not quite so concentrated. We need, generally speaking, a minimum of 40 mils because that does tend to represent the number of stem cells present to successfully carry out a transplant. So, pardon? No, not a lot. Okay, thank you for coming.